I feel like I'm slouching, which is not good posture. It's driving me crazy. If you're a therapist, you shouldn't be like hunched over trying to look at everybody on it.
Hello, welcome. We are going to talk a little bit about older adult fall prevention tonight. So we have a panel of guests, and my name is Teresa Taylor. I am a nurse at Stormont Vail Health. I work with the trauma department, and my role is injury prevention coordinator with the hospital. And so with that, older adult fall prevention is a big part of that. So kind of gathered everyone here today to talk a little bit about older adult falls and how those can be prevented. So we'll go ahead and have everyone introduce themselves, if you don't mind. And let's start with Christy. Christy Rooks, you want to talk a little bit about yourself, your role at Stormont, your specialty here?
Hi, I'm Christy Rooks. I'm a pharmacist for Stormont Vail Health. I have been for about 20 years here. Currently, my focus and role is focused on ambulatory care in the community for pharmacy.
Thanks, Christy. Thanks for joining us here. Dr. Rainey, how about you?
Yeah, sure. Yeah, thanks for having me. So I'm Patrick Rainey. I'm a family practice physician. I work at the North Fielding Clinic, which is just off 75 Highway up by the Petro Deli, if anybody's familiar. It's not my thing, but people rave about their gizzards. So anyway, so happy to be here.
Thanks for joining us. And Dr. Rainey, you're fairly new to the Stormont family, aren't you?
About 10 years.
10 years now? Okay, great.
Yeah,
well,
just
thanks
about.
for joining us. Thanks for joining us here tonight. And actually, Petro Deli, I prefer the egg rolls there. That's my...
Good to know.
Yeah,
Chicken livers.
Yeah, there you go. Amy Green, can you introduce yourself?
Sure. I am Amy Green. I'm a physical therapist assistant at the Kansa building out on 3rd and McVicker. And I am also a stepping on teacher, instructor. So I've been with Stormont Vail for about 13 years, and thank you for having me.
Yeah, that's great. Thank you for being here for this discussion also, Amy. And I'm glad you mentioned Stepping On. Amy and I actually met through Stepping On, which is an older adult fall prevention workshop that she and I both teach. And so we are typically co-instructors for those. And those are really great programs that Stormont puts on in the community. Right now, we can't have those because those are done in group settings. We do have some scheduled for 2021, and we're not taking enrollment quite yet because we don't exactly know what this pandemic is going to do, but we'll be hopeful and hope to get some of those groups going again. But so Amy has had a lot of training outside of physical therapy on fall prevention as well in older adults. So thanks for joining us, Amy.
Thank you.
So I just wanted to start out talking a little bit about the problem of falls in older adults. And in the United States, it's about every 11 seconds, an older adult is treated in an emergency department for a fall. Specifically here at Stormont Vail, with our trauma department, we track all of our injury data, and falls in adults 65 years and older account for about half of the serious injuries that we see in all patients. So some of the other injuries are caused by motor vehicle crashes, violence, even falls in younger populations. So that's the other half. So it really is a significant problem right here in Topeka, Shawnee County. And some of the injuries that we see from older adults when they have serious falls are, broken bones are a very common one. Head injuries are extremely common in older adults that have falls. And so we know that, older adults might be more prone to falling, but their bodies also might be more prone to injury when they do have a fall. And then, their bodies might not heal as quickly when they do have those injuries. So some of the other medical problems they might have can complicate the healing process as well. So I think this is just a really important discussion to have. I feel like, you know, we all know somebody, it seems like in our personal lives, an older adult that's had a fall and suffered, you know, serious outcomes, poor outcomes from that. And not to mention, you know, in our professional lives and the patients that we see all the time. So, I mean, what do you think is, Dr. Rainey, maybe I'll start with you. Do you think that falls are going to be an inevitable part of growing older? Are they something that's just going to happen as we age?
Well, I mean, I certainly think that, like you said, the risk increases significantly just because of eyesight and balance and you know, the ability to know where your body is in space and all those good things. You know, the number of medications. I mean, as I'm sure Christy is going to talk about, increases your risk for having things like lightheadedness or balance problems, which can increase your risk of falls. But I certainly don't think it's necessarily inevitable by any means, because there are lots of things you can do around the home, and there are, you know, good communication with your healthcare team to make sure that your healthcare team knows that if there's a medication that may be causing a problem, that everybody is aware about it, and we can do what we can do to fix it.
Okay, great, thank you. So let's start with that. Let's start with medication. So how do medications increase your risk for a fall? Christy, are there certain medications that do increase your risk or cause falls, maybe?
Certainly, there are certain medications that have side effects that can affect your risk of having a fall. So all medications have side effects. Some of the most common side effects of medications are dizziness and drowsiness, especially you see that in your anti-anxiety medications, your pain medications, sleeping medications, antidepressants. All of those carry those risks of those side effects that can cause increased risk of fall. And then not only do the single drugs contain those side effects, but when they have additive effects. So if you're on multiple medications that have the side effect of dizziness, then you have, of course, a higher risk of being dizzy when you're taking these medications.
Okay. All right. So are we talking about mostly just prescription medications here that are causing problems?
Absolutely not. Over-the-counter medications are always included. In fact, in over-the-counter medications, you can add antihistamines. Most of those will cause increased drowsiness, problems with balance, especially in the older population. We have to watch antihistamines. They have properties called anticholinergic effects, which can increase confusion sometimes in the elderly. As we age, in all medication, metabolism probably slows down. Clearance of these drugs, or how we get rid of them in our bodies, slows down. So we have to pay attention to not only specific types of drugs, but also the doses of the drugs. Usually we are adjusting the dosages down in people that are older, over 65.
Okay, so if I have been maybe taking a certain medication for 20, 30 years, there might come a point that I would have to, even though that dose has worked for me for a long time. Is that?
Absolutely. Dosage adjustments are common and recommended. So periodically, we should always be reevaluating what dose works for us and how we're getting the benefit from the medication, balancing that out with any side effects that we're getting from the medication. Most of the time, side effects will occur in the beginning of starting a medication. So your first 2 to 3 weeks gives the body a chance to get used to the side effect, but you'll feel the side effects more often. But if you are getting older and your dose maybe needs adjusted down, you may have a recurrence of those side effects and need a dosage adjustment for that. That should be reevaluated.
Okay, so and some of you talked about, you know, kind of maybe being dizzy or unsteady. some confusion, I think you mentioned. Is there any other side effects that particularly,
Sleepiness, drowsiness are
yeah,
the most
yeah.
common. You know, even dizziness when you're starting a new blood pressure medicine.
Mm-hmm.
Dizziness could be a common occurrence. That may be something that goes away, but maybe something that gets worse, or it becomes intolerable to you as a patient. You should always call your doctor before you feel like you want to stop or decrease the dose. You should always consult with your physician. Sometimes we can't abruptly stop medications. That would cause more harm than the side effect. So you want to make sure you're communicating your concerns with your providers and getting their advice on how to stop, if that's the plan, like to half the dose or to take it every other day, something like that.
Great, great. So Dr. Rainey, is that something that you would agree with, that you would have your patients call you if they had any side effect? I know that I feel like, as we've done some work in like the stepping on classes and things, that a lot of times older adults, they feel like, you know, that my doctor put me on this medication, that he wants me to take this. So I'm not gonna worry about, you know, if it's causing me these problems.
No, yeah, no, definitely. We definitely want close communication with your healthcare team. Just like Christy said, you know, if a medication is causing some sort of problem, then we definitely want to know about it. And if you think you need to make an appointment and maybe it's going to be a week or two before you can get there, and you're like, I can't take it, I'm just going to stop taking the medication, I would just encourage people to call their to call their primary care physician, just so that they can update the medical record. Because if somebody calls me and says, I have a question about A, B, or C, or I have a problem with this, I'm going to base decisions based on the medical record that we have. And if the medical record isn't accurate because they've stopped taking one or more medications, then it makes making decisions that are best for the individual a lot harder.
So just being in close contact is really important, and making sure that the doctor's aware if there's certain side effects. And
definitely.
Great.
Yeah, always want people to let us know what's going on, because I mean, I tell folks too, if I prescribe a medication and it starts to cause a problem, I don't know it causes a problem unless you tell me.
Sure.
And if you tell me, then we can certainly address it. We can do something about it.
And I think Christy, you mentioned folks talking to their pharmacists and starting on new medications, and that's when it can maybe cause the worst side effects or the most problems, when they just start on a new one. What are some questions that might be that you often hear from patients when they start a new medication, or that might be helpful to ask their pharmacist or their physician when they start something?
Sure. So the most important thing is that you understand why you're taking it. I take this for my blood pressure or my diabetes. Oftentimes that relates to the dose that you're on, the timing of the medication. The pharmacist should always go over, when is the best time to take it. A lot of times we counsel people, like it, for example, on your statin meds for cholesterol. If you can take that in the evening, it actually works a little better. That's when the body begins to store and make cholesterol. So if you can take it in the evening, that works best. You should be going over your side effects at that time, most common side effects of the medication, and then maybe even talking about some of the scary side effects that don't often happen, but there is that chance. So just so everyone's informed and they know what the risk is, and also discuss the benefits. So this is going to help you control your diabetes so that you don't have end organ damage or problems later down the road. Why it's important to take it. Perhaps if you take with food, it may lessen certain side effects, decrease stomach upset. If you take with a snack, it's important to understand, what you cannot take it with. Some medications you can't take with calcium containing products because it decreases the absorption, things like that. So a good time when you're picking up your medication is to ask that pharmacist for a good counsel, and making sure everybody's on the same page as to why you're taking that medication.
Okay, thank you. All right. Well, Amy, I kind of want to move into your area a little bit. Can you talk about a little bit about why it's important for older adults to maintain an active lifestyle? How does that help them to prevent falls?
Well, you know, you always hear if you don't use it, you lose it. And that's so true. So even as we age, we lose muscle. But if you keep moving, then it's going to help your balance. It's going to help with your strength, and it's going to help your not to fall. And so I think a lot of the programs that we have around our community, well, none of them right now, but before, they let you get out and walk and exercise, water aerobics. I mean, a lot of the pools were doing outside water walking and things like that. And as long as you're out and moving and functioning, and not sitting in front of the television and that kind of stuff, and you limit what you are actually doing, I think that is really going to help with your balance and your strength, and just keep you strong and keep you going.
And so is walking the best way? Is walking the best way, the best exercise, I guess, to stay active and to help that balance and strength?
I wouldn't say specifically walking. Walking's a good exercise, but you really want to focus on some exercises that are really going to focus on certain muscles. You want to make sure our whole body has to do the job to keep you balanced. And if you're weak in one area, then your other muscles are going to take over, and then you're probably going to end up a little sore, or you're going to hurt something. And so you just want to make sure that your whole body is strong, not just walking. There's exercises that you can do that will specifically go towards using specific muscles to help you maintain that balance and to get you stronger.
Great. Thank you. All right, Dr. Rainey, would you say there are certain medical conditions, certain populations of your patients that are maybe more at risk for falls, more patients that you're maybe more concerned might have a fall?
Oh, certainly. Just like Amy was saying, people who maybe aren't in the best of conditioning, are going to be more at risk. And then common medical conditions that have associated other medical conditions, like probably one of the most common ones is people who have diabetes can have difficulty with feeling in their feet or their hands, and which can make putting your feet in the right place, more challenging and more difficult. I mean, I've had a person tell me one time it felt like they were walking around on pillows because they couldn't feel the bottom of their feet. So that's probably one of the most common ones, unfortunately, because it can be challenging. It can be challenging to treat. So I would say that would be the most common. And then just in general, folks who are a little bit advanced in age, and then people who are on a bunch of different medications at the same time. And when I say a bunch, I mean, more than like 8 or 10. I think the actual number where the risk goes up is, correct me if I'm wrong, Christy, is 4, I think. But yeah. So those are probably the big 3 things that I would say.
Okay. All right. And what about vision? Can you speak a little bit to how vision, as we age, plays a role in fall risk?
Oh, certainly. Yeah. Cataract formation, cloudy vision, difficulty with vision at night. So you get up in the middle of the night to go to the bathroom, and you don't want to turn the light on because you don't want to wake up somebody else, and things like that. That can definitely be much more of a challenge. So having some light in places where you might want to go in the middle of the night, like a night light in the bathroom or something like that, could certainly go a long way to help prevent bad things from happening.
Sure. How often do you recommend that older adults have their vision checked?
Typically at least once a year. If they have some associated conditions, where they have to see a retina specialist or another eye specialist, then sometimes every 3 or every 6 months. But I would say in general, I mean, for pretty much all adults, once a year vision check is probably a good idea, just to make sure your eyes are staying healthy.
Yeah, those things come on slowly, don't they? It's like you don't even really realize that your vision is getting worse or changing, and before you know it.
Right. Yeah, definitely. Yeah.
Yeah. It happens as we get older, that's for sure. I'm learning that. Okay, let's talk a little bit. Also, let's kind of go back to some things we can maybe do around the home. And I think, Amy, you might be able to speak to this with kind of your background, and really anybody. What are some things, a lot of the falls that we see, I think, occur within people's own homes. And so what are some things that you can think of that work to help in that home environment?
You just want to really make sure that things are picked up. You know, rugs are a huge trip hazard for a lot of people, whether they're my age or whether they're older. House, whether it's by the front door or in the kitchen or places like that, if you have to have those in those spots, then you want to make sure that they're tacked down. They have a sticky mat that holds them down so they don't move when you go to step on them. And you want to make sure that the corners aren't rolled up so you're not tripping over them that way. You want to make sure that your stairs are cleared off, whether they're outside or whether they're inside. You want to make sure that there's not leaves or snow or anything, especially with the weather coming that, you know, we're getting ready to have for fall and winter. You want to make sure that those areas are cleared off. You want to make sure that you have handrails, that those are available. So if you have someone that needs assistance to get up those steps, they have a handrail that they can hang on to, and that will help them get up. Pets. You want to make sure that small dogs and the cats and the big dogs, they're not jumping on them. They're not a trip hazard underneath. Everybody, you know, a lot of people like pets, but you also don't want people falling over them. And you want to make sure that you have proper footwear. I'm a huge ASICS advocate, as Teresa knows, and I love ASICS just because they are so stable. I'll show you. I took mine
I think
off,
one
Teresa.
of these days we need to get ASICS on board so you can start getting paid to promote.
Yeah, totally.
Maybe this is the time.
So I love ASICS, and the reason that I love these shoes is because they're a stable shoe. They have a back that doesn't drop down, which means that once you put your foot in there, you don't move around. It doesn't allow you to slosh around in your shoe. Teresa and I have talked about before with our stepping on stuff that if you can take your shoe and twist it, that's a no-go. Teresa, you got them on?
We have this conversation over and over, yes.
Yeah. So those are not good stability shoes for you. You want to make sure that the sole is flexible, but it also has a good arch support. The back of it is stable and it can hold your heel in, and you actually feel like you're walking in a shoe and not a slipper like Teresa had on. So, and like Dr. Rainey pointed out, adequate lighting, whether you're inside or outside, you want to make sure that the hallways are lit, the bathrooms are lit, the stairways are lit, so you can actually see, because sometimes walking in the middle of the night or even walking from room to room, if it's dark and you're going to light or light to dark, your eyes are not going to allow you to adjust quick enough, and you could possibly trip over something. So you just want to make sure that your environment is safe.
Great. Yes, thank you.
Welcome.
Great tips. And I still have it in the back of my mind about my shoes. So Thank you. Let's talk a little bit about osteoporosis and bone health. Dr. Rainey, do you want to take that one on, and how bone health is important when we're talking about falls?
Sure. Not so much. Well, I mean, in severe cases, a bone can actually break and then the person falls because the bone broke, but that would be a severe case. In most cases, the bones lose density over time, become more brittle. Much more common in women and in men, much more common in fairer skinned people than darker skinned people. And smoking is probably the third biggest risk factor for osteoporosis and osteopenia. So the biggest thing would probably be increased risk of injury if you do fall, like just falling from, if any one of us probably fell while standing and hit your hip, you may have a bruise and maybe sore or something, but you probably wouldn't need an operation to fix your hip. But if you're an older adult and you have osteoporosis and you do just have a fall from standing height, that could result in a severe injury that does require surgery and hospitalization and then a prolonged recovery after that. So that those are, and then screening for bone density with women generally without other risk factors, starting at age 65. With gentlemen, don't quote me on this, it's either 70 or 75. But it's, like I said, much more common in women. So at age 65, unless there are chronic use of medications like steroids, like oral steroids, then those individuals would probably want to get screened a little bit earlier on. And typically the frequency of screening is every other year or every 2 years is what would be covered by most insurances, including Medicare. So.
Great. So is there anything that you recommend folks do to prevent osteoporosis, and is there treatment for it if you know you do have it?
Oh yeah, definitely. There are a number of good treatments on the market. I'm sure Christy can attest to. There's some oral medications that are typically pretty well tolerated, and then there are some intravenous medications that you go on once or twice a year to get, so you don't have to worry about taking them every day. Those medications can be very effective. Most of the medications they were studied to decrease the progression of the loss of bone density. But a couple of the medications actually have been shown to increase the bone density and to actually reverse the course a little bit. So those would be the treatment options. So there are a number of different treatment options. And the biggest things would be, like I'm sure Amy will tell us again, regular weight-bearing exercise is going to be one of the best things to help to help prevent osteoporosis. If you smoke, quit. I mean, there's so many things that smoking is bad for you about. Those are probably the biggest things. Regular exercise, avoid smoking, and then again, certain medications. But your physician or your pharmacist should make sure that you're aware if you're taking a medication long term that's going to result in possibility of osteoporosis, so that the screening frequency can be adjusted if needed.
Okay. All right. Christy, did you want to add anything to that?
I agree with Dr. Rainey. I think the first step is, as he might suggest, is always a good calcium supplement, calcium with D. That's usually the very first step that we have to do, and then everything else is additive therapy with that. It's important to get your recommended daily allowance for calcium, and most of the best sources for that is actually dietary. It's not actually your over-the-counter supplements, which can help, but it's good to have good dietary calcium intake is important. And then having the vitamin D, which helps absorb the calcium into the bone, is good. There is a limit to the vitamin D. You don't want to go overboard with that. I think the recommended dose for most people is 800 international units. So you want to make sure if you take like an OsCal with D and then additional calcium supplementation, that not all your calcium supplements contain D. You just need it from one good source. So thank you.
Okay, thank you. I think we covered quite a bit of information, so I appreciate that. And I just, Christy, you mentioned having pharmacists be able to review medications with people. And I think that Stormont Vail Retail Pharmacy has a program. Can you talk a little bit about if somebody did want to to do a review with a pharmacist, how would they go about doing that?
Sure. It's called Medication Therapy Management Service, and it is a one-on-one with pharmacists. It does occur at the Stormont Vail Retail Pharmacy location. That address is 2252 Southwest 10th. And I do want to plug the phone number too. It's 354-6787. And what happens is patients can call in and leave a message, basically to set up a personal time with the pharmacist. The pharmacist can call them back to set up that time, and we check them in how we're doing it. Similar in our clinics, our Cotton O'Neill clinics right now, they come through the drive-through, get a COVID screen. The pharmacist will come out, take their temperature, and walk them into the building. But that service provides complete medication review, dosing, interactions. The pharmacist may come up with some recommendations that they can help assist the patient in contacting providers to help communicate those recommendations. They screen for immunizations, so it's important for us to all keep up to date on our immunizations, and maybe recommend that the patient get certain immunizations. They can give them on site if that's how the patient would like to do it at the retail store. So it just opens up a whole conversation with the patient on how to move forward. And that's kind of an annual or a semi-annual event. People should really want to review and discuss their medication profile with a pharmacist on a routine basis, just to make sure, as we mentioned, we're on the correct dose, things make sense, and that all the medications work well together and don't have any bad interactions.
Okay, so that's once a year for anybody, not just older adults?
Correct. Yeah, anybody that might be on 4 or more medications, it's probably a great idea just to make sure. But in general, they can even answer questions if you want them to call you back. If you just have a specific question, that service is available also.
And I will give a personal plug for Stormont Vail Retail Pharmacy. I need to send them a small moment. They are always so wonderful and just willing to talk as long as you need to about things. So thank you, Christy, for providing that information. Sure. Amy, how about you? If there are people watching that maybe feel like they could improve on their balance or strength, maybe they feel like they aren't where they used to be, or they just would like to see some improvement, how could they be seen by a physical therapist to have an assessment or get some recommendations?
They can just contact their doctor and have their doctor refer them to therapy, and then we'll do an evaluation. The therapist will do an evaluation, and then we just work out a personalized plan to benefit them and to help them move on.
All right. Great. Thank you. And finally, Dr. Rainey, so are you taking new patients right now? If folks were interested, how could they get in touch with you if they wanted to see you?
Yeah, just the main hospital number, the 354-6000 number, and then ask for scheduling. That's probably the most streamlined way to do it. And I work with 2 nurse practitioners who are great, and so we've recently, one of them was gone on maternity leave, but everybody's back now, and so we've recently decided that we can start seeing some new folks, and so we are. And there may be a little bit of a delay, just depending on how quickly we can get people in to be seen, but we do what we can. And I always encourage people to call the office and talk to one of my nurses if they have something that it just isn't right or isn't. Doesn't seem right, or somebody tells them it's going to be 6 months before something's going to happen, that we can make things happen way sooner than 6 months. So, and then just a plug to the pharmacy service and physical therapy, both great services. Probably almost every day I refer somebody to either physical therapy or pharmacy or both. Yeah. So,
thank you.
Yeah. All right. Well, I think that kind of wraps it up. Again, thank you all so much for your time tonight and your expertise. I really appreciate it. And thank you all for watching. Have a great night, everyone.
Thank you.
Thanks.
Thank you. Goodbye.
Bye-bye.
Bye-bye.